I'm Lisa Saunders. Welcome to PACB TV out of Baldwinsville, New York. And I have here some very helpful information from a physical therapist so we can not fall down. But Bradley, go ahead and introduce yourself, what you do, and tell us what we're going to learn today.
I'm Bradley Saunders. I'm a physical therapist. I'm originally from Auburn, New York, and I work in an outpatient setting in orthopedics that mainly focuses on falls and balance prevention, and as well as some extenuation into some other balance disorders, including Parkinson's.
Okay, great. All right. Well, tell us, one doctor that I take my mother to said the biggest health advice I have for you is don't fall down. So help us. What do we do?
Yeah, actually, statistically, I don't like to start out morbid with everything, but over the age of 80% of people will experience a fall. A higher percentage of those lead to hip fractures. And what statistical data and research has actually showed us is that the hip is often fracturing in the process of the fall. So it's a loss of balance. It's not from the impact of hitting the ground.
Oh, interesting.
So the fracture actually occurs, and then we fall as a result of that. And there's a myriad of reasons that kind of play into that, from osteoporosis, deconditioning, and just weakness in our hip muscles that tend to throw us off of balance. The overall best means to be able to overcome that, as the physician said, is in addition to discussing with your physician appropriate supplementation, especially calcium and vitamin D levels. People always tend to believe that vitamin D, well, I get that from the sunshine. Well, yeah, until about age 30. And then after age 30, our body's ability to absorb vitamin D from the sun continually decreases each decade of our life. So vitamin D supplementation really tends to play a role in our overall need for bone health as we age. Additionally, one of the biggest disorders for falls that I'll get into a little bit later also has a big role with vitamin D supplementation. So a little bit more about balance and fall prevention is what I'll kind of go through over these next few minutes. And I want to start out with the basic understanding of what makes up our equilibrium. Equilibrium, in a way, is our balance. It's the three components of our body combined into one that keep us upright. The first is little cells, receptor cells in primarily our ankles, knees, and hips that tell us which are being compressed and what pressure signals are going to our brain. And then as a result, our brain processes that information and we make slight adjustments in how we stand and how we balance. For those of you that have had joint replacements, especially knees, hips, sometimes ankles, I have seen people over the years that have had all of those. When you have those surgeries, you tend to get a bunch of those cells destroyed or ripped out or changed. So then you become more reliant on your other joints to for that feedback and to pick up that information. So the more joint replacements that you've had over time, the less areas you have to kind of rely on for your balance. So that also kind of corresponds with some of the deficiencies that you'll see in some individuals. The next large component that we think about for our balance is our visual system. As we age, we tend to become more farsighted. We have difficulty with reading or seeing things up close, and different people have farsighted, and then different people have problems with nearsightedness or the ability to be able to see far, and both of those can throw off our visual field.
Okay, so if somebody's like fragile, kind of unbalanced walking, they should wear their glasses if they have them. Is this?
Absolutely.
Okay.
And I always recommend, when somebody comes into our clinic, when was the last time that you saw an optometrist, when you saw an ophthalmologist, for just overall eye health? Because you should really, especially over the age of 65, be going to yearly annual appointments to just check for health and to rule out other conditions that are common with aging, including macular degeneration. Because that narrows your visual field and can compromise your balance and stability. The last major component of equilibrium, which is the least talked about, is our vestibular system. For those boat and plane enthusiasts that are familiar with pitch, yaw, and roll of a boat or plane, that's basically what our head is doing through different planes. And we have 3 canals in each one of our inner ears that have little hair follicles that move back and forth and send those signals to our brain so we know where our head and body are in space. Those canals are filled with a pretty viscous substance. And what can happen to that substance as we age is it becomes a little bit more thick. So things don't move as easily through it. Our hairs don't move as easily through it. So our response time, which you may see if you've been with children or grandchildren at amusement park rides, you don't have a tolerance for roller coasters or fast moving things as we age. And that's a sign of those inner ear canals. The most common imbalance disorder is called benign paroxysmal positional vertigo, or BPPV. You may be diagnosed with that. People just call it vertigo, but vertigo isn't, vertigo could be a symptom or a myriad of conditions that lead to a diagnosis. By itself, you don't walk around and say, I have a bad case of pain. You have pain because of something else, and you have vertigo because of some other condition. And typically, in the majority of people, it is BPPV. And what that is you have calcium carbonate crystals. If you remember at the beginning, Lisa, we discussed talking about the vitamin D supplementation. Well, calcium and vitamin D work together. It's why we fortify our milk with vitamin D, because they help each other with absorption. And what we find is people with low levels of vitamin D consistently will have a buildup of calcium carbonate in a little sac called the utricle in our ears. And the calcium carbonate builds up and it spills out or falls out into those canals. And when those calcium carbonate crystals hit the hairs that tell us where we are in space, it gives you the perception of spinning or dizziness. This is something that's very easily treated with physical therapy.
Really?
Often
Okay, I
people
didn't
will
know that.
go to the hospital
Mhm.
and believe that they're having a stroke. People will be put on commonly on a medicine called meclizine, which was designed as like an airline sickness medication.
Mhm.
But really all that does is it dissipates the symptoms. It masks the symptoms that you have from BPPV. But
Mhm.
typically you could go to a physical therapist in as few as 1 to 5 visits, depending on the severity, have most of those symptoms alleviated.
Wow.
I have seen patients that have gone years without treatment for this, that have been scared to get in or out of bed because of that perception of dizziness, and have actually slept in recliners. So just know that if you're afflicted with that, if you have those sensations, discuss it with a therapist or a physician and get help. There's hope. The growing vestibular field overall in terms of our balance is rapidly changing. It also corresponds and plays into concussions, which are at the forefront of a lot of news cycles. So a lot more research has gone into that over the years, because believe it or not, after low back pain, dizziness is the number 2 reason that people seek medical care now.
Wow. Because people complain to me all the time that they're dizzy or something. Now I'll be armed with things that I could give them that perhaps can help, obviously, other than seeing your doctor, but this is very interesting.
Yeah, and that's always definitely, primary care should always be your first line of defense for things. In many cases, unless you know that you have a history of BPPV, you could go directly, depending on your state and your state laws, go directly to a therapist. You don't need referrals in most states to have direct access with therapy anymore. But there's other things that play into that also. A lot of people we are as a society have a lot of hypertension and a lot of hypertensive issues, high and low blood pressure, hypotension, and those changes in blood pressure or the way that our body responds to blood pressure medications also is very common to cause those perceptions of dizziness. So it isn't all inner ear related, and it's not just confined to those 2, but those are the starting points that can really help out a lot of people overall.
Well, I know that Northeast is really, these people up here are really bothered by vitamin D deficiency. Do you find that in regions of different countries of the country?
Yeah, I've been fortunate enough to practice in about 9 different states now. And being born and raised in upstate New York, I know that We average about 79 sunny days a year. So it's pretty much one of the least sunny places in the greater Syracuse area in the country. I was fortunate enough to live in Colorado Springs for a while. They have 310 days of sun a year in Colorado Springs.
So do you happen to know if they have a better vitamin D levels or?
Well, and every part of the country does have, from medical histories that I've taken with patients, they do have lots of different, what you'll see is consistencies across things. The Colorado area, I think a lot due to mining and soil changes, I saw more colon cancer there than I've seen anywhere else in the country.
Wow.
I think that the Northeast does tend to have, and in the mid-Atlantic area down into Maryland, Delaware, do tend to have higher incidence of BPPV. I don't know, research-wise, if there's literature that shows it is regional or confined to the country, part of the country you live in.
All right. Well, do you have any other advice to prevent falls?
Yeah. So, these three components in summary, as far as your visual system, your vestibular system, and your balance system, all you want to maintain as fine-tuned as you can. So visual system, your first place to rule out is optometry, ophthalmology, maintaining eye health, wearing glasses when appropriate. For your vestibular system, that's a combination of starting out with primary care and potentially, physical therapy. If there's additional workups that are needed for vertigo or other symptoms, that's where specialists for ear, nose, and throat, ENT, and neurology can come into play depending on the type of dysfunction. Sometimes long-term therapy. I'm a vestibular certified therapist. I treat a lot of long-term vestibular disorders also. There's patients that I'll see for several months to work on other combination of vestibular disorders. But the last component is the component that everyone out there can kind of work on their own, and that's your proprioception and balance components. And just making sure that you're challenging yourself wherever your safety and comfort levels are. I like to recommend to my patients to just stand at the kitchen sink where you've got support, you've got something that you can hold on to, and you can practice putting one foot in front of the other and trying to stand there and hold that for 30 seconds. Start for a few days with just one foot in front, try it again a few days later with the other foot in front, then progress towards being able to close your eyes for 30 seconds and still holding on. So if you feel like you're losing your balance, you've got the sink or something to be able to hold on to that's stable, so that you're not really going anywhere. If you have concerns, have a loved one, a caretaker, a neighbor, somebody stand with you while you practice these. Doing your best flamingo impression is another great one to be able to do. Standing on one leg for all of it, and going through that same routine. That really helps work those little proprioceptors and can over time just start to improve your balance.
That's very helpful. Thank you. I'm going to share all this information with my mother, and I'm sure a lot of people are going to share this with their parents.
And then finally, I think for the other prevention component is home fall hazards. Take a look at your home objectively, or if you're really averse to moving objects around your house and you may need a little coaxing, have a family member or friend come over and look at things. If you're an individual that catches yourself what I like to call furniture walkers, they go from the chair and they try to hold onto the chair, and then you walk along the couch, and then you walk along the kitchen counter because you don't feel steady. That's probably time that you need to start to improve your balance before a fall occurs. That means you're probably at a higher risk for falls. And again, physical therapy is a great place that you can get baseline levels of measurement to see if you are a low, moderate, or fall risk. There's patients that I consider, and I tell them to come back every year for a checkup for therapy as a preventative measure, and just see that you're maintaining your scores for all of your balance and fall risk. But if you bring those family members or friends, or you're able to look objectively at your home, look for loose cords, rugs, throw rugs, other things that can be in the way that can be tripped over. If you know that you have to get up during the night, as many of us do as we age, to go to the restroom, having night lights present in the hallways, in the bathroom, making sure that water is cleaned up in and out of the shower. If you have the financial means to remodel your bathroom to have a walk-in shower or have a seat in the shower, that helps a lot of a lot of fall risk as well. So
Where do
you
you
can do in
find
your home to
people
mitigate that.
falling? Do you have like a statistic or some fun fact about what people fall usually over?
Yeah, the bathroom is almost 2/3 of all falls happen, in or right near the bathroom. And that's involves toilet, in and out of bathtubs and showers, slipping on the rugs or carpets that are on the floor to prevent water slippage, or people that even just drying their hair like they normally do, and if they have vestibular issues or they can't see because they've lost, they cut off their vision when they're drying their hair or putting the towel on them, they can become disoriented and lose that balance. Because your system overall, if your eyes are weak, your vestibular system will try to pick up the balance. If your proprioception is weak, your eyes and vestibular system will pick up the slack. They try to help out one another, but you don't know if your vestibular system has a dysfunction that you're dominating on your eyes to help keep you steady, that all of a sudden, if your vision is distorted or it's dark or you're putting on a shirt, that things can really get thrown off very quickly.
Well, thank you, Bradley. Thank you so much for your help and advice, because some of this is very new to me. And as I get ready to enter my twilight years, I'll think of what you told me.
Yeah, know that there's hope.
There is hope. My goodness. And now I am going to lecture some people I know about putting on their glasses. So I'm not so nervous when they walk. All right. Well, thank you so much. If anybody wants to reach out to you or has a question, do you have a website or an email or?
Yeah, I think the best way for people that are more social media savvy is through LinkedIn. If you look up Bradley Saunders, I'll come up as physical therapist for that. There's not a whole lot of me. It has my photo that looks generally like this.
Okay.
That's probably the best way to reach me. There's, if you have other general questions, you can reach me at Bradley Saunders, BradleySaunders, DPT, that's for Doctor of Physical Therapy, D as in dog, P as in Paul, T as in Tom, @gmail.com.
Well, thank you so much for coming on the show and giving a lot of great advice, especially to us Northeasterners with our vitamin D deficiency. But now I know that as we get older, we can't process it as well anyway. So it doesn't matter where we live in the country. We have to worry about it.
And it's something that can be looked at during your yearly blood work. So when you go in for yearly blood work or checkups, you can ask them to just make sure that they're checking vitamin D along with that too.
All right. Well, thank you so much.
Of course.
All right. I hope to have you on again. If you ever have another topic you want to share, we'd love to have you.
Certainly.
All right. Bye.